Laser vision correction has helped millions of people improve their vision to the point that they can say goodbye to glasses for good. But if you have poor eyesight and been thinking about having the procedure, how do you know if you're a good candidate? Dr. Jeffrey Gold from Libery Vision is back today with Jason Carlascio, who has had the procedure. He had it back in April. Gentlemen, thanks for being here.
Thanks for having us.
Thank you.
Jason, let's start with you. Talk to me about your eyesight before you had the correction done.
My eyesight was very poor. I was dependent on glasses constantly. It was really a hassle too. Wherever you go, you had to have eyeglasses. If for some reason you're driving somewhere, and your glasses broke, you have a hard time seeing. It was a cost too. You know, every year, every other year, to have to get glasses. I also spent a lot of summers at the Jersey Shore. It was even, I remember, a hassle going to the beach or a hassle doing something that you really like.
So was there a moment where you said, I have to take care of this, or that you needed to call Dr. Gold?
Yes, actually. My business partner Rose told me about it, mentions I should have LASIK, and a few people have mentioned it. And I saw Dr. Gold actually on this show, and my mother did, and I gave him a call, and I took it from there. Very good. And what about today? I see excellent. I love my vision. It's great. I'm not dependent on glasses. I didn't want to go down the road of contacts. It's great. When I was at the Jersey Shore this summer, I could see great. When I go to a sporting event like a football, or even when I was at Yankee Stadium, it was great. The vision.
Sure.
It was better than glasses. Better than having glasses.
Probably a whole lot easier. You bet you wished you did it a little sooner too,
yes,
right?
That's correct.
Dr. Gold, tell me a little bit about your practice.
Well, our practice is unique in that when people call for a screening, having seen us on WTNH, the first person that they meet with is me. And I do all of the screening procedures, I do all of the pre-op work, I do the surgery, and then I do all of the post-op care as well.
Very good.
Another thing that makes our practice unique is that we only offer custom laser vision correction. I know of other practices around in which the patient can choose a less expensive form of laser vision correction by going standardized. The problem with standardized treatment is that every eye is considered to be an equal of every other eye. So somebody with a prescription of -3, regardless of the contour of their eye, they're all treated the same. And that's not true in my practice. We do custom treatment only.
Sure.
And the other unique factor is we offer 0% financing for a year. So the patients have a year to pay off for the procedure.
That's great.
With no interest.
Very nice. So, Doctor, if you would compare Epi-LASIK and LASIK for us.
I have a graphic that shows the difference between LASIK and Epi-LASIK. In LASIK, the cornea is cut open, as you can see in that picture on the right, and a flap is folded back. The laser treats the underneath part of the cornea, and the problem is that when the flap goes back down, although the edge seals overnight, the interface between the two layers never fully heals. So those eyes are vulnerable forever. If the person gets hit in the eye just wrong and the flap comes loose, they've got an hour to find me to fix it, or they're going to need a corneal transplant. Whereas in Epi-LASIK, nothing is cut. And I think the next graphic shows how I take off the surface layer only. It works sort of like a snowplow on your driveway. And that layer is called epithelium, and that's why the procedure is called Epi-LASIK. The laser then changes the shape of the second layer down, and when those cells grow back over the next 3 days, the vision is restored with no cutting, no weakening of the cornea, and no vulnerability to getting hit in the eye for the rest of their lives. Much safer.
Sure. So who would be an ideal candidate for this?
Anybody who is 18 or over and who has finished growing in terms of their eyesight, and I insist on seeing their last 3 eye exams to determine that, and then there's no upper age limit. So the only people who are not candidates for the procedure are people who we discover with a couple of scans that we do to have a pre-existing corneal degeneration, or the cornea just too thin to have the procedure done safely.
Okay. And Jason, do you have any advice for someone who might be considering the procedure?
I think they should go ahead and do it. A lot of things. You don't have to worry about glasses, having them all the time. And I like Dr. Gold because he does the most up-to-date procedure with no cutting. And also the cost of glasses, you're looking at, spending probably a year $400 or $500. in a few years, you'll get that money back.
Sure, no need for glasses anymore. And Dr. Gold, you have a special deal for Connecticut Style viewers?
Yes, anybody who calls in and mentions this program receives a $200 per eye discount, and we've extended that same offer to all first responders, active duty and retired military to honor their service.
Very good. So for more information, you can contact Liberty Vision at 203-281-5745 or visit libertyvision.net. You could also find Liberty Vision on Facebook. You're just about everywhere, Doc, aren't you?
Just about.
Well, thank you both for being here.
Thank you.
All
Thank
right.
you.